The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. According to the CDC, the number of daily shootings in the United States has gone up from 91 per day to 124 per day. Think of that, 124 shootings across America each and every day. And it's not just in the famous ones in Buffalo, Uvalde, and most recently in Tulsa. In 2022, we've had more than 230 mass shootings. All of this has led to more than, it's hard to say, 18,000 gun deaths across the country since the beginning of this year. In the Bronx, since the beginning of 2022, we've had 40 gun deaths, 40. These numbers may seem unfathomable. They are certainly not acceptable to you, but they are, in fact, cold, hard steel reality. Tonight, we'll take a look at guns and attempt to determine how we can stop the madness that is turning our nation into a killing field. And so please join me in welcoming the Executive Director of Stand Up to Violence, SUV, at Jacoby Medical Center. Welcome back, Carjah Dawkins-Hamilton. Nice to see you.
Thank you. Thank you for having me.
And the Program Manager of Community Initiatives from S.O.S, Save Our Streets, the Center for Court Innovation. It is Marisol Rivera. Nice to have you with us, Ms. Rivera.
Thank you.
Let's start with you, Ms. Dawkins-Hamilton. For people who don't know, explain why Gary thinks SUV is a brilliant innovation in the Bronx, is something that we need desperately, and we need to even duplicate in other places. So talk to me about what you do and your unique approach and why a hospital is dealing with gun violence.
So yeah, the Stand Up to Violence program is based out of Jacoby Hospital Medical Center here in the Bronx. And what we do is we aim to reduce gun violence in our community. And we also, like you said, we're hospital-based. So we see all patients that are assaulted, we see all patients that are shot, and just providing wraparound services while they're here in a hospital. In addition to, we do have an outreach team that curb the gun violence that are in our communities that affect certain areas of the 47th precinct, the 43rd precinct, and the 49th precinct. Like you said, we're a hospital-based initiative, so we've been around for 7 years, actually almost 8 years. One of the first of its kind, in the sense that we are targeting or attacking gun violence as the patients are coming in, but we also are working in the community to really work with our participants, program participants, in trying to prevent gun violence and trying to prevent them from becoming patients here.
And in the number of dialogues I've had with you and the director, Dr. Romo, the philosophy is that it's a health problem. After all, if somebody is shot, that becomes a health problem. And so we use health resources to address it. What I'm very interested in, of course, you treat the people who come in with wounds, that goes without saying, but you mentioned wraparound services. I want to explain what that means. As I understood it in the past, what you had done was find out what maybe a conflict was and then get to the source of that conflict. So why don't you talk more in detail about what you actually do?
Yeah, so when I say wraparound services, what we do is when a patient comes in, and if it's a patient who is, was shot, we respond with a team with Dr. Roma, as you mentioned, who's our medical director, a social worker who provide more mental health services and counseling, and also an outreach worker, a credible messenger who is credible in the community, who can mediate in conflict, who come in and also meet with the patient kind of get a sense of what happened, what brought them to us in the first place, right? And the credible messenger meet with them, we also and try our best to prevent any type of retaliation. So if it's connecting this patient with community resources, or connecting them with resources that we provide, whether it's employment resources or just helping them with follow up, providing referrals to social services, um, whatever that looks like, we try and provide as much as possible. Sometimes there might be a safety concern. We'll help them, whether it's moving, we'll help them with moving. We'll help them with. We've done help with funerals before. We kind of helped with kind of whatever the family might need and whatever will help them kind of get through this traumatic incident or traumatic event.
Before we bring Ms. Rivera in, I want to ask you just about how that's going. The numbers are just horrible. Do you get
Yes.
the sense that you are getting somewhere, that you have an effect? Have you seen maybe circumstances where you've turned somebody around, where you've had them put their guns away? I mean, is there a result to this? In theory, it sounds wonderful.
Yeah, definitely we've seen that just how effective our program has been. Prior to the pandemic, we had excellent numbers, right? We saw a decrease in gun violence in the community, but we also saw a decrease in gun violence in patients coming in. After the pandemic, or since the pandemic, we definitely saw an increase in gun violence. We've definitely seen a 181% increase in the amount of shooting victims that we're seeing in the hospital. So there definitely is an overwhelming amount of patients that we're seeing now in comparison to before the pandemic. But definitely what we've done in terms of really connecting our patients with resources, connecting them with our outreach team, we've seen how effective that is. So when a patient meets with our credible messenger here, or our hospital responder here, they can also be connected with a mentor if they're from our area. They can be connected with someone who can continue to walk them through, getting back and re-engage in school. They can meet with a social worker. They can meet with a medical professional like Dr. Roma, who can really explain their injury and how to make sure that they are continuing to be healthy and following up with their appointments. So we've seen definitely the success stories where people have turned their lives around due to our interventions. We've seen where families were able to move out of specific areas because of our interventions, so they can feel safer in a different area. Or we've helped them move from one school to the next if that's something that they'd like to do, if it's something that happened in school or close to their school. So we've definitely seen the successes over the years. We know that when we are treating violence, we have to treat it as we would any other public health issue. It cannot just be a one prong approach. It has to be a multiple prong approach where we all tap in and work together in making sure that our patients are taken care of and our communities are taken care of.
This is why I say that we need to do this more and duplicate the programs elsewhere. That's a much larger question. Ms. Rivera, I'm going to read to you a simple Google search. All I did was say Bronx shootings 2022, and here you go. 11-year-old shot by someone who was chasing a man in a motorized scooter. Fast food worker obsessed with ghost guns, killed one, injured two others in a Bronx shooting. Bronx man answers a knock at the front door, gets shot to death. 20-year-old shot in the face, killed after meeting with alleged motorcycle sellers in the Bronx. That's 4 of the 40. What do you see with Save Our Streets? What are people saying? I'm guessing the fear is palpable, that people are just saying it seems so random. Anywhere I go, I could be in danger. It's a horrible thing. So what do you see, and what do the folks at Save Our Streets see?
Well, definitely, like, Ms. Carjah said, that the violence has definitely increased since the pandemic, and everybody's scared. No one feels safe. So, although we're in the streets and we're doing the best we can, I feel like we need to do more, exactly how that looks so far. More canvassing, more bodies on the street, more resources, things to do for our young people. Because we can't say put the gun down, there's no open gyms, everything is closed, there's nothing for them to do. They have to have something they want to do, something constructive, something that they're interested in, so it could get their attention. And we can take it from there, but definitely listening and just having parents talk to their kids at home as well. It's just not the community and the community based organizations problem. You have to talk to your kids at home, let them know what's going on, let them know how to handle themselves when they're in the streets. But I definitely do agree that since my 8 years working here, I'm about to make 8 years, this has been the worst it's ever been. So hopefully it has to get better before it get worse,
The
because
numbers
this is
on the numbers in the United States of America back that up. So in 2020, there were 19,000 gun deaths all year. In 2022, we already in May, or now we're beginning of June, we have 18,000. So there's no question that the numbers are worse. I want to ask you, Ms. Rivera, the dialogue out there on crime in general, but these are the worst crimes, it would seem. I don't want to measure them, but these are pretty bad crimes. They say that the approach that you're talking about, the people who say, don't defund the police, that was a phrase that went awry, but they say the social service approach does not work. You talked about more programs for kids to do, keeping the gyms open. I mean, that can be done, but it needs funding. Do those concepts work at stopping gun violence and maybe making that 40 a little less at this point next year?
I would say absolutely. If you're giving them something to do and giving them, like I said before, it was PALs open. It was a lot of gyms that was open where you could go in there, even if you didn't want to play sports, you just go in there, relax with your friends, read a book, work out, anything. But we definitely have to open up more things for our young people to do, so then they're not in the street or they just not going the wrong way. Because when you have too much time on your hands, it can be negative. I
What,
was young before too.
what do you hear? And I'm going to ask Ms. Rivera, Ms. Carjah Dawkins, the same thing. But Ms. Rivera, what do you hear from young people about guns? Are they saying, hey, I'm going to get me a piece because I'm not taking a chance, and they can all figure out how to get it because it's readily available? So Ms. Rivera, your thought on that. What about the availability of guns, and where are they getting these guns?
We all want to find that out. That's a good question. We don't know. But what I will say is that the ghost guns is making it way worse because they're not traceable. It doesn't ring, so um that makes it worse because all these young kids are having guns and we don't know where it's coming from. So if you're a young person and you're just walking around with a gun, you just walking, God forbid, you just walking into a situation, you're going to go to jail, you're going to be in a grave. And that's what, me and Sister Carjah want. We want to get to these kids and get to the youth before that happens. Because a lot of them is just misguided. They just following the trends of their friends or just following what's going on in the community and not being a leader. So we definitely have to do better with, everything. We just need everything better because it's just disgusting. Like, I've never.
I told you before the show I'm quite upset, and I think all of us are upset. Ms. Dawkins-Hamilton, let's just ask you the same question. What do you hear from people who have been involved in gunplay in terms of getting shot? Do we know where they're getting the guns? Certainly one of the questions is the iron pipeline that brings illegal guns up here, or they're coming from other places. Ms. Dawkins-Hamilton, what do you find? What do you know?
Yeah, I think, like Marisol said, I think it's hard to say specifically where people are getting guns because I think now more than ever the access is there, right? So New York has the best gun laws in the country, but New York is just one state. You can go next door and get a gun somewhere else, right? So I definitely see that, or we definitely see that where the access now is crazy how easy it is to get access to a gun, right? Before it was like, I feel like the community did a lot better at community policing ourselves in the past, where we knew or community knew like a 13-year-old shouldn't have access to a gun, or if they did, it's kind of limited. While now it seems as if the younger population are getting access, and no one is policing our communities in terms of us as a community really realizing that no, a 13-year-old shouldn't have access to a gun, a 15-year-old shouldn't have access to a gun, 11-year-old shouldn't have access to a gun. So I think now more than ever, the access is there because of the fact that the other states aren't New York. The other states aren't doing what they need to do to make sure that their laws are protecting the rest of the nation.
You brought up the idea of laws. Let's talk a little bit about legislation. One of the things that comes up all the time that this is a mental health problem, that it's not a gun problem, that if you have people who are have mental health issues, and those are the people committing the crimes. Ms. Dawkins-Hamilton, what do you think about that? What do you? I mean, is that a valid thing to say? Well, let's deal with mental health.
I think it's easy to just pass it on to mental health, right? Definitely, there's some mental health issues happening, and we need to not only just think about mental health. Like when we think about taking a public health approach, it's not just taking one specific thing. It's looking at the bigger picture, right? It's the education. It's all of it. It's not just okay. Well, it's just mental health. It's but it's also access, right? So it's all of them being getting their own little areas and playing their own little part in making sure that those needs are addressed. Yes, we need to address the mental health needs of our people. We just came out of COVID. We're still in COVID, right? So many people were affected by just being in lockdown for such a long time. Our kids aren't as engaged as they were. If I could speak from my perspective, they're not as engaged as they were pre-COVID in schools. So what are we doing? Like Marisol said, what is there to replace that? There's not a lot of different things that are there to replace that. So we also have to look at our education system. There are different things that we have to look at to make sure that gun violence decreases. It's not just one thing. It's not just, well, we need to do this or we need to do, no, it's looking at all the pictures. So yes, mental health does play a role, does play a part. Access to guns definitely plays a role and plays a part. And so we have to look at all of the parts, the moving pieces, not just one.
Ms. Rivera, the young people that you talk to and the young people that you work with, do they need somebody to talk to? Is it as simple as that they have been sitting in front of screens for 2 years instead of being in school with their peers, maybe without the kind of activities they need to have? Do you find that even just having somebody to talk to in a healthy way, if they have issues or they have conflicts, can help them resolve it?
Absolutely, because our young people just need to be listened to. Sometimes they don't have nobody listening to them, really interested in what they want to do, interested in their goals and their future. That sometimes they got negativity around them all the time. So they come around us and we try to listen to them and support what they actually want to do, because that's the key to it. You have to listen to our young people, see where they at. And half the time, they start to trust you, which is our credible messengers, they'll call you before they want to do something negative. They'll actually call you and say, oh, I'm about to get into a situation. And if they calling you, they want you to help them, talk them off the ledge. That's basically what it is. So once you gain their trust, they'll feel comfortable to speak to you. And then you can let them know that not every incident have to end with violence or with gun violence at all.
Can you give us an example of somebody you talked to in that circumstance? Like, what were they saying to you or one of your colleagues, and you were able to say, hey, look, the gun is not the way to solve this problem? I mean, I don't want to put you on the spot, but I'm assuming you know what they're saying.
A couple of times I got a phone call from maybe one of my participants who's inside of the community, and maybe, he was having something to drink, and he just went a little off and started to argue with his friends. So they called me. I went over there, spoke to him in person, and I let him know, these are your friends. You got to apologize to them. And, he was happy, and he really did it. They was like, I'm surprised he did. He apologized because he was wrong after I broke down the whole story, and I was able to prevent further violence, I would say.
Did you really suspect, or did you or your colleagues think that whoever that was had actually had a gun? And that could have been the next thing, or he was going to go home and get the gun and come back?
Absolutely.
Wow. Ms. Dawkins-Hamilton, let's just talk about, new technology. There's talk about gun detectors in the subways, these things that can kind of identify a gun instead of other metal as you walk through the turnstile. Obviously, we can't stop every patron in the turnstile. Are these the kinds of innovations that you think the city of New York should invest in? Or is that really step two after we take care of the mental health piece and provide the kinds of activities that Ms. Rivera is talking about?
I think it's all together, right? I don't think you should, when it comes to gun control and really decreasing gun violence, we all have to do it all together at the same time. We have to make sure that our young people have access to things to do outside of, like when they have their free time. We have to make sure that there's things available for them to do there. We have to have access to mental health services. If they put stuff in the turnstile, then they'll go somewhere else. They won't take the subway. So with any new innovative technology, people are gonna try and figure out a way around it. So I think also we have to think of other creative ways to address the issue, address our young people, see what's going on, see how we can best support them, see how we can best help them, and really addressing all the issues, not just tackling one issue or the other, just addressing it all. If, like installing metal detectors in the subway is going to make people feel safer to take the subway system, then by all means, go ahead and do it. But we also still need to address the other issues. Address the issues of our young people not having access to things, and addressing the mental health concerns. It can't just be one thing. It has to be all of it being addressed at the same time.
Do you think that percentage-wise, so to speak, where is the availability of guns in this circumstance? In other words, is availability a big thing so that if somebody has a beef, they can readily get the gun? Or is it one of those things, the person who was going to do this was going to do something anyway? You know what I mean? I mean, where does the availability issue come in? Because the opponents to gun legislation are saying it's not the available guns, it's all these other factors. So is the availability, we'll ask you both the same question. We'll start with you, Ms. Dawkins-Hamilton. Is the availability of guns a big factor in the rise in numbers that both of you have seen?
I think so. I think when you have a country that there are more guns than people, then the availability is there, right? So whether or not, yes, New York has really good gun laws, and we've done our part, like I said before, but if everybody else is now not following suit, it's just putting a Band-Aid on the issue. It's just triaging the issue. It's not dealing with the root cause and the all the issues. It's just dealing it from a very surface level. So yes, if you'd asked me this 2 years ago, I would be like, no, like it's not access, but now it's access.
Yeah. Ms. Rivera, I'm assuming you agree with that. I mean, you talked about the ghost guns, which, again, there could be legislation about it. And, in my mind, it's completely sensible. One of the other things that we hear after the school shooting in Texas was teachers should be armed, and that this is a way to keep people safe. Former President Trump said it in front of the NRA. He said, well, then let's, arm all the teachers. Everybody should have a gun. Ms. Rivera, your thoughts on that? Would that be helpful? Would you feel, and you think parents or others would feel more or less safe in the school if teachers were empowered to take matters into their own hands? It's Ms. Rivera, that was for you.
I would have to say I don't really agree with that. I would agree with I'd rather have metal detectors in the schools to prevent, and I said this, I'm not going to lie, you guys, probably about 6 or 7 years ago. Every school, no matter how good you think the school is or the neighborhood, should have metal detectors, and people could think twice about bringing anything because the metal detector will pick it up.
Ms. Rivera, let's just wrap it up. What's your final message? And let's just say there's somebody who says, you know what, I'm thinking of shooting up a store. I kind of would rather not do it, but I'm mad at these people. My friends are always hanging out there. I'm going to do something bad. Who should they call? What should they do? And using your S.O.S. as a resource, what do you think? And then Ms. Dawkins-Hamilton, you're going to get the same question.
They definitely should reach out to SUV or S.O.S. Bronx so we could try to help them, because you have to help our young people in conditioning their mind first. Once you condition their mind, they can make better choices. And my message is to everyone, it's not worth it. It's not worth going to jail, and it's not worth dying. You can handle situations without violence. There are ways to talk about it, conflict mediation, stop shooting, start living. That's my message.
That's nice. I like that. Stop shooting, start living. How is there a phone number you pick up the phone and call you?
Absolutely.
Or you want to give it out?
9131. That's the office
Do
number.
it. Do it again.
646-448-9131.
Somebody to talk to you. Same thing for you, Ms. Dawkins-Hamilton. What about for if you want to get in touch with SUV? Let's say there's a school that says we need your help, or an organization, or some other aspect of what you do. Tell me how they can get in touch with you.
Yeah, definitely. We're accessible. You can call us at 718-975-6312, 718-975-6312. Just remember, one shot fired is one shot too many. We really have to put the guns down. Bullets don't have names on them. And now's the time. Now's the time for us to really end gun violence.
And you know, we want to say just before we go, I've got the flyer here. We can put it up on the screen. You guys are having the annual Peace Walk. Of course, to me, Peace Walk should be every time you go out of your building, but because that's how we want to go about things in the Bronx. But tell us a little bit about that. We got a couple of seconds for you to do that.
Yeah, on June 16th at 5:30, we're going to meet at Astor and Wallace to start with our Peace Walk. It's a 2.3-mile walk. We're going to end all the way on White Plains Road and 229th Street. It is our annual walk that we do every year. We walk up the streets and we really talk about ending gun violence, and it's a really empowering moment to get out there and to talk to the community and to really do something about the gun violence in our communities.
You know, and I want to just add, we're recording this a couple of days before it's going to air, but Ms. Rivera talked about marching across the Brooklyn Bridge and running all over the city to do exactly the same thing. You know, it is a gun. We'll say goodbye to you. Thank you to both of you, Carjah Dawkins-Hamilton from Stand Up to Violence at Jacoby, and Marisol Rivera at S.O.S. Save Our Streets. We thank both of you. And folks, it is Gun Violence Awareness Month. To me, we need Gun Violence Awareness Month June, July, August, September, October, all the way around. So yes, it is Gun Violence Awareness Month. We did the show, but we need to keep on all of the issues that our guests are talking about tonight. And that's it. We will see you next week for more. I believe next week we're going to start our debate series. We'll do a couple of debates leading into the Assembly primary. So stay with us for that, and see you then. Thank to our producers, Stephen and Rebecca, and our director is Benaya. And guess what happens now? We say good night. Good night.